Our last speaker is going to talk about gun violence research. She is Dr. Linda Degutis, the Executive Director of the Defense Health Horizons and an adjunct professor at the Rollins School of Public Health at Emory University.
Good morning. Thanks. So I'm going to talk about some of the issues that have occurred with federal research funding and some of the issues that have occurred with research agendas. We've heard a lot of reports of research this morning, and obviously a number of things that are successful, but we really don't see as much research on gun violence as we do on other diseases that are causing public health, our major public health problems. So basically, the federal funding for research has been at pretty much a standstill since the Dickey Amendment passed in 1996. That amendment actually didn't say that research could not be funded. All it said was that federal money couldn't be used for advocacy for gun control, is basically what it said. So it didn't say you couldn't do the research. However, the conversations that went on around it basically threatened the CDC in saying, oh, well, if you do fund the research on gun violence, we're going to start to think about shutting you down or shut down the injury center, which had been formed not all that long before. So that amendment then a few years ago was added to the NIH appropriations bill, and we still see restrictions on the federal funding. But basically, funding from 2004 to 2014 for gun violence research was only $20 million. And in the context of the federal budget and what gets spent on other things, it's basically decimal dust, is the way policymakers would put it. But it doesn't mean much. It's like the pennies that are in your pocket, So after the Sandy Hook killings occurred, President Obama issued an executive order that told CDC to resume the research on violence, resume the funding on gun violence research. It told Congress to appropriate $10 million, another, few cents, basically, to fund gun violence research. And then it told CDC to develop a public health research agenda and ask federal agencies to study the causes of gun violence, to identify what interventions could be effective, and then to develop strategies. However, there was not any funding associated with this, and so there were a number of things that did not happen. What did happen was that at the CDC, we worked to develop a research agenda, but that was not without some fighting. At the time, I was the director of the Injury Center and said that we could not internally develop that agenda because it would be seen as biased, and so we had to fight to have it go over to the Institute of Medicine and have them do it. They did develop the research agenda and published it in June of 2013. And that was basically, that's basically about all that happened out of that list of things in the executive orders. There was no resumption of funding of gun violence research by the CDC. The message that was given was that there was no funding for it. There was no thought to using funding that was there for violence research. That was not something that was allowed, and this came from a higher level. It was all political. People were afraid to do something. They were afraid to say, okay, we're going to start funding the research, because there was still that fear that we were going to lose money. CDC would lose money. So to me, it was kind of being chicken. We'd seen so many events. We'd seen so many things going on. We know how many deaths there are, but the research was not funded. So on the left-hand side of this slide, you can see research funding for various diseases. And that little tiny bit at the bottom, the fourth one up, is where the money goes towards gun violence research. So the proportion of money that goes towards research on gun violence, one of the leading killers, especially of young people, is very minimal. And it just is not sufficient or comparable to what gets funded for other diseases. So basically, we have a long way to go. But what we do know is that research funding for other leading causes of death and illness and disability have really made a major dent in those illnesses and those causes and those injuries. And one of the examples is motor vehicle crashes. We know that there was, especially back in the late 80s, early 90s, there were a lot more deaths in motor vehicle crashes than there are now. The reason is that we did a lot of things in order to prevent them. We didn't take away cars because they were killing people. Okay, everybody still can get in a car and drive, but we did other things. We found out what might work as far as vehicle redesign. We found out what kinds of things might work as far as vehicle redesign for preventing some pedestrian injuries, the interiors of vehicles. Some people may remember that a lot of the knobs were pointed or something, and if somebody hit something during a crash, you could have a fairly serious injury. And I remember, and Carnell probably does too, seeing people with, like things embedded in various parts of their body in the emergency department because the vehicles had these very dangerous kind of things on the inside. Those don't exist anymore in the manufacture of vehicles. We made the roads safer. We did other things on roads. We found out that maybe putting a big sand barrel in front of a bridge abutment really absorbed the energy if a car crashed into it, as opposed to the car crashing into the solid concrete barrier. So there's a lot of things that we did, and we did improve things. We have changed driver's licensing now so that there's graduated licensure laws in most states, so that young people have to have experience riding with someone, driving with someone who is an adult who's a licensed driver for a period of time before they can get a license. So those have all been effective. So we know that those kinds of things can work. One of the other things we know is that the lack of research really limits progress. It doesn't allow us to understand what works. What it does is it sets things up so that people say, well, I think this would work, so let's just do this. Oh, I think this would work, let's do this. And we invest a lot of time and money in things that don't work. They end up not working because we don't have any research to tell us what will work. We just have emotion and we have people's ideas, and it doesn't work necessarily. I mean, the ideas maybe need to be tested, but, just think about some of the things that have come out now, on policy and things like, in some states, arming teachers. Is that an effective policy, or is it more likely to be detrimental? What about active shooter drills? We're finding out now that those may be more detrimental to the kids in the long term than they are as far as actually helping kids survive something that happens. What about bulletproof backpacks? It's a great marketing strategy that somebody has, playing on parents' fears. But, how effective are these? We have no evidence that they really would work, and a child would have to be wearing the backpack when a shooter came in. And then we even don't know if it would work, depending on, the angle the shooter was coming from. So we don't have a lot of things that we know work. Federal funding's definitely influenced by politics, and as Dr. Webster mentioned earlier, the groups that can come in and lobby on a single issue and advocate for things on a single issue. So we need to have other funding. Private funding can fill some of those gaps, can help retain some independence in the research questions that are asked, and allow people to ask a number of research questions. And then basically, I think the other piece of it is having funding that is going to academic centers where people can decide what questions they want to ask. they have the independence. You're a researcher at a university, the university doesn't tell you what questions you can ask as far as your research goes. If you're in a federal agency, the federal agency may tell you what questions you can ask as far as your research goes. Having been, when I got to the CDC, somebody told me, don't even say the word GUN, okay? Because it's just not a good idea, because we might get in trouble. So, that doesn't happen in academia. You can research whatever you want. So I think those are the kinds of things that we need to think about as far as where the research gets done too. That it needs to be done by people who are more independent in their research, can ask the tough questions and can test things out, do the research. So we have some opportunities. We have opportunities for basically to move, as far as researchers go, from just publishing the data to translating the data to the public so it can affect change, or working with people who can translate that data so that the change can be affected. It may be that people who are doing the research don't have the time or opportunity to do that, but there are people out there who can. They sometimes need some interpretation of the data or translation of it, but there are plenty of people who might advocate. We can make science integral to identifying, these effective policies and really push for that and let policymakers know on all levels that this is what's really important. We should consider using more kinds of things that really provide collaboration, require collaboration. We've heard about the need for a lot of disciplines to be involved in this, not just one group, but it's the hospitals, it's the community, it's social work, sociology, it's law enforcement. There's so many different groups that need to be involved, and we really need to focus on having that kind of collaboration and involvement. So that's another thing we have an opportunity for. Training opportunities are other things. If we don't train people to do this research, we're not going to have any researchers to do it later. We really need the training opportunities, and we need the funding for them. It's not, those aren't there either. The training funding isn't there the way it is for other kinds of health issues, so we really need that as well. And certainly practice needs to inform the research, as it has for a number of these studies that people have already been working on. But we really need the practice to continue to inform the research, and we need the multidisciplinary collaboration. So some recommendations. Congress should fund gun violence research at a level that is similar to that for other public health epidemics, such as the opioid overdose crisis, HIV, infectious disease. How much money went to Ebola and how many cases of Ebola occurred in the United States? Okay. So we should be funding, spending a lot more money on gun violence. Congress should fund improvements in the databases and ensure that researchers have access to those databases so that they can look at some of the impact of these policies and some of the strategies that are used. It also would be important to have a core group of experts, again, look at priority research topics, perhaps revisit what was done at the Institute of Medicine and either update it or expand it, but have a more independent organization like that be able to convene the group so that the bias accusation is not there. And it didn't come out before either. Congress should also fund training and mentorship for people who are learning how to do this research. States can fund research and translation of research as well as the programs that are related to that research, and we have a couple of states that already have been doing that. The private sector certainly can provide funding for any kinds of initiatives or research that are sort of related to the private sector's mission and the intent to keep people healthy. And everyone should really focus on funding the research so that we know what works, not what we think will work. And really what they should do in summary is, do what will really improve the health of the public, and for legislators, not what you think will get you reelected or elected. So that's where we should go.
Great, thank you.